Right. So in this section, then we're going to be looking at again, as part of principles of exercise, we're going to be looking at programming specific exercise. So what we're going to cover is programming exercise for health and fitness, programming exercise for cardiorespiratory fitness, muscular strength and endurance, flexibility, motor fitness, and then looking at adapting training for special populations. So just a recap from this morning, can anybody tell me what the 5 components of health-related fitness are? It's kind of on the screen already.
Body composition,
Yeah,
cardiovascular, cardiovascular endurance,
yeah,
yeah, muscular endurance, muscular strength. What was the last one?
flexibility.
There you go.
Cool. There you go. So cardiovascular fitness, muscular strength, muscular endurance, flexibility, and body composition. So we're going to kind of cover all of these and how we program for different clients with different goals regarding cardiovascular, muscular strength, endurance, flexibility. So again, just a little bit of a recap. So 30 minutes per day of accumulated exercise in short periods is recommended by the National Institute for Health and Clinical Excellence, the British Heart Foundation, and the World Health Organization. So 5 to 7 days a week, low to moderate intensity exercise for 30 minutes, and the type of exercise or activity includes physical activity and everyday tasks, cycling, walking, heavy housework, and DIY. So these guidelines are going to help for improvements in health. So when we look at this FIT principles, it's the FIT principle and guidelines for health. So this is the bare minimum that people should be doing to just ensure that they are going to be living a healthy lifestyle when it comes to activity. Okay, so programming for fitness benefits are usually more specific. So we're focusing on improving or maintaining one or more of the 5 components of physical fitness that we've just spoken about in this morning's session. Now we structure our exercise based on specificity, progressive overload, reversibility, adaptability, individuality, recovery, and plateau. So let's have a quick discussion on each of these then. So specificity, what do you think we mean by when we are structuring our exercise based around specificity?
As it says, specifically one particular thing.
Yeah. So we're talking specific to the client, specific to the client's goals. So if the client has got a goal of losing weight, then we need to ensure that our programs are specific to weight loss. If we've got a client who wants to increase muscle mass, we need our program specific to increasing muscle mass. Okay, so specificity, obviously, our program card needs to be specific to the goal that is set for the client. Progressive overload. What do we mean by that?
It's like aggressively upping your weight in exercise.
Yeah.
As you get stronger.
Good. Yeah. So we're increasing the intensity or we're increasing the time. So we basically need to make sure that our client is constantly being challenged when it comes to their activity that they're doing. If there's not a challenge there, then we're not really going to see the benefit of that exercise. So progressive overload will help to prevent one of the other ones that we're going to talk about in a little while. Reversibility. What do we need to consider here?
Not sure with that one.
Okay, so with that one, it's about if we need to take a step back. So, for example, if you've got a client who goes away on holiday for 2 weeks, we're not really going to pick up where we left off within those 2 weeks. So we need to be able to kind of take things back a step and then rebuild that back up to where they were. Similarly, if your client has got an illness or if they're got an injury, we need to take a step backwards and rebuild back up to where we were previously.
Mm-hmm.
Adaptability.
What are we thinking here? Adapting to a client's health situations or facilities that you have access to.
Good. Yeah. So exactly that. Being able to adapt the program. So if I've got the program set up specifically for the gym, but the client says, "Oh, I'm actually away with work for the next week or so," we'll be able to adapt the program so that they could do it outside or they could do it in a different type of gym or a different type of environment, as you said. Good. Individuality.
Every client's different abilities.
Different
Yes.
goals.
Yes, good. So individuality. So what works for one client might not work for the second client. So if we've got two clients, client A and client B, who are both looking to lose weight, the same program card won't work for both clients. So we, as you said, we need to make it individual to them, to their likes, to their needs, to the type of exercise that they like to do, their skill level, their experience. So as I said, one program card doesn't kind of fix all goals, if that makes sense. Recovery. What do we need to consider here?
Just about what the client may do or eat after an exercise. So for the next one, they're recovered.
Exactly. So we need to make sure that recovery is incorporated into their program or into their activity sessions, because that's where the adaptation occurs. So making sure that they've got time in between sessions to be able to recover fully, for their body to be able to adapt to the activity that they've been put through, but then be fully recovered to get the most benefit out of the next training session that they've got. And then finally, plateau.
That where you reach a point where you're not increasing your goal, you're at a stage where you need to do more.
Yeah. So you basically you've hit a stalemate. So you've kind of seen improvements, but then everything is kind of leveling off. So if it's a weight loss client, they'll find that, oh, I've lost a lot of weight, but then suddenly they're really struggling to lose any more weight. Or if somebody is doing strength training, they've got stronger but are struggling to get stronger again. So this is where progressive overload comes in. So we need to make sure that we continue to overload, we continue to progress the sessions and progress the exercises to avoid that plateau and just to constantly see benefits and see improvements. Cool. Okay, so what I've got on this slide is basically a description of each one of those. I won't read this out to you because we've discussed them individually, but it's there for you to kind of recap over that if you want to. So then we're going to look at guidelines for cardiorespiratory training. Cardiovascular fitness is often referred to as stamina, endurance, cardiorespiratory fitness, heart and lungs, or aerobic fitness. All these terms essentially refer to the ability to take in, transport, and utilize oxygen. So what we're looking to do is to increase our VO2 max. So V standing for volume, O2 oxygen. So the maximum amount of oxygen that we can take in each breath. Cardiovascular exercise can be defined as being rhythmic in nature, continuous, uses large muscle groups, under low to moderate over an extended period of time, and frequently referred to as aerobic exercise. So a quick and simple method for measuring exercise intensity for aerobic work is to use heart rate. So heart rate is measured in beats per minute. So we've got our resting heart rate. So resting heart rate is a good measurement of fitness level. So the lower the resting heart rate is, the fitter the individual is. The maximum heart rate is an age-adjusted prediction. So we've got 220 minus your age will give you the client's maximum heart rate. Stroke volume is the amount of blood pumped per beat, and cardiac output is the amount of blood pumped per minute. To calculate cardiac output, we can simply multiply our resting heart rate times stroke volume and will give us cardiac output. So the amount of beats per minute times the amount of blood pumped per beat will give us the amount of blood pumped per minute.
Well, just a question on the maximum heart rate. It says age-adjusted prediction.
Yeah.
Say, for example, if that was higher than 220 minus their age, is that maximum heart rate during the exercise? So you have to adjust the exercise to make sure that they're not going over that.
Yeah.
figure.
So 220 minus their age. So if we've got a client who's 20, for example, so 220 minus 20, their maximum heart rate would be 200. Now, we will see people hit 200. So people at the age of 20, we will see people hit their maximum heart rate. It's not going to cause long-term damage or anything like that to hit the maximum heart rate. What we would look to do is just reduce the intensity a bit and bring that heart rate down a bit. I've seen clients before go above, and I've done it myself, gone above my maximum heart rate doing high intensity exercise. Again, you won't be able to stay there for very long because you're working at top level, you're working at your maximum capacity, so you won't be able to stay there for very long. But if you notice that you are hitting that maximum heart rate, it is advised just to gradually bring that heart rate back down to a more manageable level.
Okay.
But it's not something to kind of get scared. If you've got a client and all of a sudden they've hit their maximum heart rate, don't panic about it. You know, it's not really going to cause any damage, but it is advised just let's calm things down a little bit. Okay. Okay. So physical exercise and the heart. So the heart is a muscle, specifically cardiac muscle. It improves in response to overload. So challenging the heart, putting it under pressure, if you like, and making it work, will see improvements and will see benefits. So heart rate is very individual. The size of an individual's heart is not necessarily an indication of their cardiovascular fitness level. Now, what we would look at is resting heart rate, and this will be lower in response to regular and progressive cardiovascular training. So as time goes on, as people do cardiovascular training, we should see the resting heart rate reduce. And there's massive health benefits in reducing the risk of coronary heart disease when we do this type of exercise. So the stronger the heart muscle is, means that we're going to reduce the effect or reduce the risk of coronary heart disease. Okay, so we did this on the course when we were together before, when we're looking at our 4 key aerobic heart rate training zones. So we've got the moderate aerobic zone, which is gentle introduction, which we're working at 50% of maximum heart rate. So maximum heart rate is 220 minus the age, and then we would work out 50% of that to ensure that that's the minimum line, the minimum heart rate that our client needs to be training at to see health benefits or physical benefits.
Is that during the exercise?
Yes, during the exercise. Yeah. So weight management zone is a moderate intensity. We're looking 60 to 70% of maximum heart rate. This is classed as the fat burning zone and is suitable for most individuals. So we can see most of our individuals, a lot of our beginner clients will be able to work in this zone. So it is classed as the weight management zone is classed as a fat burning zone. Now, more recent studies have shown that high intensity interval training is going to burn more fat. But if we've got a beginner client, if we've got a client who is quite overweight, high intensity interval training is not going to be suitable for them. So this is the zone that we would work in to reduce their body fat percentage, to reduce their weight, to increase their fitness level. And then as they become more, as their fitness level goes up, as they lose some weight, then we can start to introduce more high intensity work as they become more experienced. The next one then is the aerobic fitness zone. So this is a vigorous intensity, 70 to 80% of maximum heart rate for improvements in cardiovascular fitness. So your endurance athletes will mainly work in this zone. And this is basically for people who just want to get fitter. So not necessarily for losing weight, but want to increase their fitness level. The peak aerobic performance zone then is the challenging intensity, 80 to 90% of maximum heart rate. And we would mainly use this for very well-trained individuals. So this is your top level. This is working at a high intensity. Your clients won't be able to stay in this zone for a long period of time. But what we can do is we can use this when it comes to interval type training. So we could push them up into the peak aerobic performance zone, bring them down for a recovery, back up into the peak aerobic performance zone, back down for recovery. So we can vary the intensities when it comes to that. Okay, any questions on any of that?
I think we're quite good on that.
Cool. So you can use this then and gauge, okay, what's my client's goal? So if I've got a client who plays football, then maybe we'd be looking at, okay, we can definitely push them into their aerobic fitness zone. And then maybe we're going to do some more interval type training when it comes to sports specific work and push them into their peak aerobic performance zone. If you've got a weight loss client, then we'd be looking to push them, keep them into the weight management zone. If I've got a complete beginner client who's just been introduced to exercise, then maybe it's between the moderate aerobic zone and the weight management zone. So we can look at their goals and decide what training zone we want them to work in. Exercise intensity and cardiovascular adaptations then. So heart rate changes in response to exercise. So heart size will increase, stroke volume will increase, resting heart rate will decrease, oxygen uptake will increase, so VO2 max. Heart rate is a valid measure of both the exercise intensity and the cardiovascular performance progression, your fitness level. So if I've got a client whose resting heart rate today is at 70 beats per minute, and then we check it again in 6 weeks' time and it's at 65 beats per minute, we can see that they're getting fitter because their resting heart rate is lower. We can also use heart rate during exercise to see if our clients are improving at a certain exercise intensity level. So, for example, if I've got a client who works at is working on the treadmill 10 kilometers per hour for 10 minutes, and we measure their heart rate in 6 weeks' time, after training for that 6 weeks, what should we see that heart rate be, higher or lower for the same activity? Lower, yes. So over 6 weeks of training, that heart shouldn't have to work as hard as it did 6 weeks previous with the same activity level. So we can use it as a gauge to see if our clients are increasing their fitness level or not. So heart rate is affected by a number of factors, medication, pregnancy, etc. So obviously they're things that we need to take into account and get extra advice and guidance on if we need to. However, there are other ways of measuring intensity levels. So you've got two types of RPE scale. So the second one is the one that we will use. So the RPE Borg 10 scale. We can also use the talk test and observation. So I'll just bring up the RPE scale and then I'll explain how we can use talk test and observation as well as using the RPE scale. So this is the RPE scale starting at level 1. So as you are now, so sitting on your laptop, obviously, so hardly any exertion, but more than sleeping, watching TV, etc. Light activity, so level 2 to 3, feels like you can maintain it for hours. It's easy to breathe and carry out a full conversation. Level 4 to 6 is moderate activity, breathing heavily, can hold short conversations, still somewhat comfortable, but becoming noticeably more challenging. Level 7 to 8, vigorous activity, borderline uncomfortable, short of breath, can speak a sentence. Level 9, very hard activity, very difficult to maintain exercise intensity, can barely breathe and only speak a few words. And then 10 out of 10, maximum effort activity, feels almost impossible to keep going, completely out of breath, unable to talk, cannot maintain for more than a very short time. So when we're working with our clients, we can then set an intensity level that we want them to work at. So this will correlate with the heart rate training zones as well. So if we think about 50% of maximum heart rate is going to be level 5 on the RPE scale. If we think 60 to 70% of maximum heart rate, our weight management zone is going to be between our moderate and our vigorous activity. Then our aerobic zone is between 7 and 8, and then our peak performance zone is anywhere in the above the 8, 9, and 10 bracket. Okay, so using the talk test, we can simply ask our client different questions, see how they answer. Can they carry out a full conversation? Are they only giving us one-word answers? Are they giving us sentences? So we can gauge from their response as to what kind of level they are at on the RPE scale. We can also use observations. So how do they look? What's their technique like? Has their technique improved? Has their technique decreased in standards? Do they look physically out of breath? Can we see them breathing heavily? Can we see them sweating? Technique is probably the biggest one that you will see, whether they are working at a high intensity or a low intensity. So our clients need to understand the RPE scale to be able to answer correctly. So if we ask them, okay, where do you feel on the RPE scale? They need to know what each stage feels like and what each stage means really. So if we've got our client doing a warm up, by the end of the warm up, we should need them at a level. We should have them at a level 5. If they're saying that they're at a level 8 by the end of the warm up, we need to consider, okay, number 1, do they understand what the RPE scale is? But number 2, have I pushed too hard during that warm up and pushed them above where they need to be? So we need to gauge it as we go through. Any questions on that?
No.
Okay. Guys, you've got a bit of background noise going on, so if you could just click mute for me.
Yeah, sorry.
That's all right. Cheers, thanks. And then obviously unmute when you want to jump in and ask questions or anything like that, Okay, so little recap from earlier as well. So benefits of cardiovascular training. So our short-term effects during exercise. So when we do cardiovascular training, heart rate, blood flow, oxygen uptake, cardiac output, and stroke volume all increase. Blood vessels will dilate. Concentration of carbon dioxide in the blood will increase, and thereby breathing rate will increase. Muscle temperature and overall core body temperature increases, and the levels of lactic acid in the blood will rise. So during exercise, this is what happens when we train cardiovascular system. When we look at the long term then, the lungs, we get increased capacity. So we use more of the lungs, they don't get bigger in size. So we think about the lungs as two kind of air sacs, two balloons. We're going to be able to fill them more. They're not going to get bigger. The lungs are not muscles. The blood, we get increased transport. So blood volume and red blood cells are transported around the body. The heart, so we get increased cardiac output because of a larger and stronger heart muscle. The blood capillaries got increased number, so that means then we've got an increased exchange of gases, carbon dioxide and oxygen. Blood pressure can reduce or normalize. The muscles, we've got increased mitochondria, so we get better oxygen utilization. The bones, so improved density, but this is dependent on our weight-bearing activity. And our blood fat profiles, so LDL and HDL profile changes. So LDL are our low density lipoproteins, HDLs are our high density lipoproteins. So HDLs are the good. So this is our cholesterol markers. So what we want is to make sure we've got more HDLs than LDLs. And then blood pooling, something to consider. So because of an increased blood supply to the working muscles, we need to make sure that we do a full cool down to prevent blood pooling. Any questions on cardiovascular training?
No.
Okay, so moving on then to muscular fitness and muscle fiber recruitment. So we're looking a little bit more now at muscular strength and endurance training. So the health benefits of training and doing resistance training is that muscular strength and muscular endurance will increase. We can look at increasing the muscle fiber sizes and improving the effects of training on the muscle fiber types. We'll improve our muscle fiber recruitment, so the nervous system response and the nervous system attachment to the muscular system will improve. We can increase our muscle mass, so it is testosterone dependent, and we can also then look at how we improve the energy systems, so our phosphocreatine system, lactic acid system, and aerobic system. We can get improvements there by doing resistance training. Neurogenic and myogenic strength gains, so that means the nervous system and muscular system, we can increase strength, and also our physiological adaptations. So by being stronger and having more muscular endurance, it means our whole physiological system can improve. What we've got here is the muscular fitness and muscular endurance continuum. Sorry, muscular strength and endurance continuum. On the left-hand side of the scale, we've got muscular strength. So to train muscular strength, we need to ensure we're working at a high intensity with very high resistance, so a high weight. So that needs to be above 75% of 1 rep max. Our repetitions then need to be low, so between 1 and 10. I'll come back to this in a second. Our muscular endurance, low to moderate intensity, low to moderate resistance, so light weights. So we're looking 40 to 60% of 1 rep max. And we need our repetitions to be high, so between 15 and 25. Now, for pure muscular strength training with experienced clients who had done regular weight training before, we would be working at high weights. So we're looking at maybe even 80 to 90% of 1 rep max, and our repetitions would be down between 1 and maybe 4 or 5 repetitions. So really, really high weight and really low rep number. Our guidelines here state between 1 and 10 repetitions. If I've got a beginner client who wants to increase muscular strength, I'm not going to start at a really, really high weight and really, really low reps. I would work at about 75% of the 1 rep max and working at maybe 10 repetitions. And then as they improve their experience, as they get used to strength training and being able to deal with the effects of DOMS, we can then start to reduce the rep number and increase the weight further, or increase that percentage of 1 rep max that we're doing. Similarly, at the other end of the scale, if I've got a client who's a beginner, I would maybe be looking at 40% of 1 rep max, but maybe looking at 15 repetitions. And then we can start to increase the repetitions as they become more experienced.
Oh, and if you've got a client who's relatively experienced, is there any detriment to doing both types of exercise?
No, it just purely depends on what they want to achieve. So if they're experienced, if they want to purely do muscular strength, then obviously we'd stick to the muscular strength side. If they're just looking to kind of maintain what they've been doing, we can mix up the two. So looking at muscular strength and muscular endurance work. So we could maybe do it like, 2-week blocks. So 2 weeks of strength training, 2 weeks of endurance training, and then repeat that process. So we've also got, you can also work in between this. So hypertrophy training, if somebody wants to increase muscle mass, we would be working kind of down towards the strength end, but you're looking between 8 and 12 repetitions for hypertrophy training. And that's kind of, we're looking at our experienced clients as well. So our weight is going to be quite high. It's going to be up at the like 60 to 80% of 1 rep max, depending on their experience and what they're currently doing. But we can kind of work in the middle as well. So kind of looking at a little bit of both. Does that answer the question?
Yeah, that's perfect.
Cool. So our guidelines for improving muscular strength and endurance: 2 to 3 times per week. Now, I hate this bit here, okay, because it says here 1 set of 8 to 12 repetitions for adults under 50, 1 set of 10 to 15 repetitions for adults between 50 and 60. It doesn't seem to account for people over the age of 60. So what I would do is scratch this and basically forget the adults under 50 or 50 to 60 and just say our intensity is 1 set of between 8 and 15 repetitions, depending on whether they're working strength, which would be 1 set of 8, or endurance, 1 set of 15. Okay, so I'm not a fan of that intensity there. What I would say is for our beginners, 1 set of 8 for strength clients, 1 set of 15 for endurance clients, and then we can build from there. Time, about 60 minutes, about an hour per session. And the type of exercise we're doing, 8 to 10 exercises for major muscle groups with a whole body approach. Now, as I said, this is very, very basic. I would never do a session like that with a client. Okay, I would never just do 1 set. I would always do a minimum of 2 sets, because we want to see in that rest period, how did the weight feel? Can we push a little bit more? Do we need to take a bit off for set number 2? And then we'd build from there. If I had a beginner client, first session, and I did 8 to 10 exercises for major muscle groups, and we were looking at strength training, they wouldn't be able to move the next day because of the effects of DOMS. Okay, so we would maybe take it, split sessions. So let's do legs on Monday. We'd maybe do chest and arms on Wednesday, and then back and shoulders on Friday, just as an example. So we'd split it up, allowed their body part to recover while we're training a different one. As people become more experienced, then we can start to increase the times per week, so the frequency. Again, doing split sessions, we can start to increase the set numbers. We can really be specific on our repetition numbers, and then get more specific on the muscle groups that we're going to work. Okay with that?
Yeah, cool.
Okay, so again, just a little bit of a recap here on DOMS. So DOMS is the stress on connective tissue. So micro tears in the muscle fibers when we're doing resistance training. So it's muscle stiffness or pain 12 to 72 hours after exercise. It's a risk for new clients or following a change of exercise routine. Now, eccentric training, there's a 30 to 40% more resistance capacity than the concentric phase. So if we think about a bicep curl, the concentric phase is when we curl it up and the muscle is shortening. The eccentric phase is when we lower the weight back down to its starting position. So we can potentially lower 30 to 40% more weight for our bicep curl than we can lifting it. So the eccentric phase is stronger than the concentric phase. So if we work eccentric training, where we've got somebody that helps us lift the weight up to the top, and then we slowly lower down through the eccentric phase, we're going to get a higher level of muscle damage. So we're going to get more micro tears. So we are going to experience DOMS, but it is going to help to increase strength more. You're going to see a benefit of strength by doing eccentric training. However, it's not suitable for detrained or beginner clients. Okay. If you move on to level 3, we look at one of our resistance training systems is eccentric training, and we go into it in a lot more detail. But just to know that the eccentric phase is stronger than the concentric phase. But if you train eccentric training, you are going to experience DOMS quite a bit more. Okay, our benefits of muscular strength endurance training. So I'm just going to bring all these up here because we've kind of looked at these this morning again. So increase in bone density, increase in resting metabolic rate, decrease in body fat, blood pressure and blood cholesterol levels, improve self-image, posture and core stability, and also decreases the risk of injuries. So when we do muscular strength endurance training. So what a lot of people also find with muscular strength endurance training is some people will come in and think, oh, I don't want to put on muscle. And I feel that if I lift weights, I'm going to put on muscle and I'm going to get bigger, and they don't want to get bigger. As long as we prescribe the correct sets, reps, and weight, we can ensure that the client doesn't increase muscle mass. So if we do strength training, it doesn't necessarily increase muscle mass. If we do endurance training, it doesn't necessarily increase muscle mass. Okay. If we do hypertrophy training, obviously that will increase muscle mass, but these are the benefits that we can give to our clients that muscular strength endurance training has, and this is what it's going to do for them. Okay. Any questions before we move on to flexibility?
No, we're good.
Yeah.
Okay, so flexibility training then. So our guidelines. So flexibility is a measure of the maximum range of movement possible around a joint or a group of joints. There's an age-related awareness of flexibility. So as people get older, flexibility tends to reduce or decrease. So we should try to do it more and more, as it's an underrated and under-practiced component of physical fitness. And there are many health-related benefits for maintaining good flexibility. So different types of stretching that we do. We've got our static stretches, which include passive and active stretches. So a passive static stretch is where something else is creating the stretch for us. So for example, if I'm going to stretch my hamstring, I place my foot onto a bench and then I lean forwards and stretch out my hamstring. That is a passive stretch because the bench is facilitating the stretch for me. An active hamstring stretch would be where I would lift my foot off the bench. So the opposing muscle, my quadriceps and my hip flexors, have to contract to create the stretch. So that's an active stretch. If I just show you, with me. Can you guys see me? Okay, so if you can see me on here, okay. So if I'm doing a pectoralis major stretch and I use the wall, so if I've got the wall here and I create the stretch here, the wall is going to facilitate the stretch for me. Okay, so that's a passive stretch. However, if I just simply contract my trapezius and rhomboids behind me and create the stretch, that's active because the opposing muscles are creating the stretch. So passive, I'm using something to create the stretch, like the wall or a door frame. Whereas without that, then I'm just going to kind of create the stretch myself by contracting the opposing muscle. That make sense?
Yeah, that's good.
Cool. Okay. So static stretches, both passive and active. We've also got our dynamic stretches. When do we use dynamic stretches?
It's like while moving.
Yes, while moving. So as part of our warm-up, we would include dynamic stretches. Our static stretches would be done as part of our cool down. Excuse me, ballistic stretches. So this is where you would bounce in the stretch. Now, for our clients, we would avoid ballistic stretching because it's quite advanced, but you might see kind of sports athletes and professionals who would do ballistic type of stretching, preparing for whatever activity or sport they're doing. And the final one then is PNF stretching. So this is, again, an advanced form of stretching, but it's assisted stretching. So the personal trainer or fitness instructor would complete this type of stretching for the client. And again, if you come on to level 3, that's where we would do PNF stretching. So when to stretch: short prep stretches during the warm-up, maintenance stretching during the cool down, and developmental stretching during the cool down or in specific stretch sessions. Some different factors that could affect flexibility. So the structure of the joint itself, what condition the ligaments and tendons are in. So if they've had any damage, if you've had ligament damage, for example, it's going to affect the flexibility around the joint. Opposing tissue bulk, whether that be muscle or fat. The muscle itself and its connective tissues. Gender, so as we said earlier this morning, as you said, females are more flexible than males. Age, people tend to get less flexible as they get older, so we need to try to start it early in life and continue it on. Time of day, so more flexible later in the day than you are first thing in the morning, because you're moving around during the day and warming up the joints. And then the temperature, as we said, so the warmer you are, the more flexible you'll be. So our guidelines for flexibility training are minimum 2 to 3 times per week, ideally 5 to 7 times per week. Intensity 3 to 4 reps per muscle group to the end of the range of motion without inducing discomfort. So we need to feel the stretch and not pain. When they say 3 to 4 reps, that would be hold for 10 seconds first, that's rep 1, come out, go back into the stretch for 5 seconds, that's rep 2, come out, back into the stretch for another 5 seconds, that's rep 3, and then rep 4 would be another 5 seconds. So 10 to 30 seconds for each stretch, and a static whole body approach. Benefits of flexibility training: it'll improve quality of life, it'll improve sports performance, it'll improve posture and reduce stress, also helping to prevent risk of injuries. When we think about special populations and flexibility, we need to consider, so children stretching with care. They've got soft joints and go through growth spurts. So we need to be careful when it comes to that type of stretches. So we would only do maintenance type stretches. So 1 rep, and that is 10 to 15 seconds for the stretch. We wouldn't be doing multiple repetitions when it comes to stretching. For pregnancy, there's an increased ability to achieve a greater range of movement due to the effects of relaxin. So relaxin is a hormone that is released into the body during pregnancy to help to increase the range of movement around a joint in preparation for childbirth. So relaxin can remain in the system up to 5 months after childbirth. So if we've got a client who is maybe 4 months, 3-4 months after childbirth, relaxin can still affect the system. So stretch with care, short stretches only, and avoid developmental stretching. For the aging population, potentially increased muscle stiffness. So there's a potential decrease in their stretch potential, and potentially they lose heat a lot quicker. So again, it's kind of making sure that we use short stretches, but it's probably more important that we do stretching for that population than anybody else. For disabilities, so exercise options may be limited due to the disability. So the range of movement might be limited due to the disability-related inactivity. So because they're not as active, they may not have the range of movement as a more active person. Then we just need to make sure we consider those options carefully and seek professional advice. So get advice and guidance from them, and get advice and guidance from any medical professionals that they have worked with them. Okay, repeat that slide. Okay, so our final section then of this bit is where we're going to look at general training considerations for special populations. So when we work with young people aged between 11 and 16, a sedentary lifestyle in young people can have negative health consequences both now and later in their life. An obese child has an 80% chance of growing up to be an obese adult. This is possibly due to unhealthy lifestyle choices and learned behaviors from their parents. A younger person who is active will have stronger muscles and bones, a leaner body, controlled body fat, and be less likely to become overweight, a decreased risk of developing type 2 diabetes, possibly lower blood pressure and blood cholesterol levels, and be more confident and have a better outlook on life. So we need to avoid prolonged high intensity anaerobic training. So we can do it, but not for a long period of time. And avoid high resistance training. So avoid heavy weights, low reps. Include interval type training. So what this means is, so rather not high intensity interval, but intervals. So they'd work for a period of time, rest, work for a period of time, rest. So this will reduce the impact and the intensity between efforts. Incorporate body weight exercises, thinking about gravity and lever length as resistance. So what we can do here is thinking about the range of movement. So if we're doing body weight squats, we can think about the range of movement. Start off working top half and then gradually increase that to going a little bit lower into the squat. Functional activities such as pulling and pushing, and activities to develop motor skills. So to improve the speed, power, reaction time, agility, coordination, balance, etc. Also, we need to think about child protection considerations and legislation. So making sure that there's safeguarding policies and procedures in place before we start to work with young people. Okay, so working with pre and postnatal clients. Exercise plays an important role in promoting health and well-being before, during, and after pregnancy. Women who exercise during pregnancy have reduced weight gain, more rapid weight loss after delivery, improved mood, and improved sleep patterns. Women who exercise regularly during pregnancy may have less incidence of induction, faster labours, are less likely to require epidural, have fewer operative births, and a quicker recovery from delivery. Pregnancy is a highly complex physiological process, and precautions are needed to ensure that exercise does not contribute to any complications. So after birth, most of the physiological changes persist for 4 to 6 weeks. Therefore, gradual introduction of pre-pregnancy exercise should be based on capability. Okay. So avoid supine position exercises after the first trimester. So supine, where we're lying on a back face up. So avoid this after the first trimester as the fetus starts to grow. Avoid developmental PNF or ballistic stretching due to the effects of relaxin, and also avoid high impact exercises. Include interval type activity or interval type exercises again. So work, rest, work, rest. Maintenance stretches, so just static stretches. Core stability exercises. So that can be as simple as sitting on a stability ball when we do an exercise, to thinking about sitting on a bench and really concentrating on posture, and also balance exercises as well.
Oh, and a quick question on the avoiding supine position exercise after the first trimester. Is that because you will be putting excess force around the abs area?
So what you're doing, so as they lie on the back, because as the fetus grows, it's going to lie on the inferior vena cava, so it'll reduce the blood flow back up to the heart.
Oh, so it's got nothing to do with exercise, it's where the position of the heart is?
Yeah, it's where the position of the baby is.
Actual vein.
The inferior cava, isn't it, at the bottom?
Yeah.
It's all the same one. It's just
Yeah. Top and bottom. Okay.
Obviously, we wouldn't do any prone lying exercises either, because they're going to be lying on the fetus. But lying on their back will it'll reduce the blood flow back up to the heart.
Right.
Okay.
Okay. Okay. Older people. Okay, so working with older people. So the advancement of age is something that happens to us all. People are commonly living well into their 80s. There's an increased need to be physically fit to enable individuals to be independent and enjoy life. Age should not be a barrier to exercise. Regular physical activity can stimulate physical and mental health, increase mobility and independence, improve stamina, strength, posture, coordination, and reduce the risk of falls, reduce the risks of osteoporosis and fractures, help to overcome loneliness and isolation, and assist in reducing anxiety and depression, and promote a sense of well-being. So this is really important for people who maybe have that barrier of, oh, I'm too old to do physical activity, I'm too old to do exercise. We need to make sure that they're aware of the benefits and what it's going to do for them if they do start to participate in exercise and physical activity again. Because, you know, as people tend to get older, and I've experienced this with in-laws and other people that I know, where they just kind of say, oh, I'm too old to do anything. But we need to, as fitness instructors, educate them on why it's so important. And these are some of the benefits that they will gain from it. Okay, so working with older people. So these safety guidelines are defined by the National Occupational Standards, and they include avoid high impact exercises. So anything that we're going to have a lot of pounding, so running, jumping, things like that. Doesn't mean that you can't do it for some. So we will look at the individual and see what their activity level is like. So we don't kind of tar everybody at a certain age with the same brush. We will basically say, okay, let's see what you've been doing up until now. Let's see what we can introduce. Let's see what we can keep doing. So if they've been doing running, they've been doing high impact, then continue doing it. If somebody hasn't done it, then we would maybe avoid it. Prone or spinal flexion activities. So that's to reduce the effects of kyphosis. As people get older, a kyphotic posture tends to develop. So if we're doing prone exercises where we're doing face down exercises, or we're doing like abdominal curl exercises, it's just going to enhance that kyphotic posture. So we try to avoid that and do more pull-in type exercises for them. And then also including complex choreography. So we think about there's a reduced processing time of information. So if we get them to do complex choreography, to try to process that and physically do it can be difficult. But again, we look at an individual basis. If it's something that they've done quite regularly, continue it. If it's something that they haven't done, maybe start off nice and simple and then gradually progress it as you move along. Include back extension, in particular thoracic extension, to improve posture, as we mentioned with the kyphotic posture. Interval type activities, which allows for rest between harder bouts of activity. Functional activities to assist in everyday tasks. Things like squats are perfect because it's going to help with getting up and down out of a chair. Multi-joint compound type activities. So doing more compound exercises are going to be more beneficial than doing isolation exercises. Balance activities and core stability activities to include as well, which will help with that core and balance and coordination. And then finally, our disabled individuals. So there's over 10 million disabled people in the UK. Only 7% are sufficiently physically active for disease prevention. Appropriate levels of physical activity is known to reduce the incidence of certain chronic diseases by as much as 50%. Disabled people may realize greater benefits from keeping physically active, as it can help to reduce, manage, or even reverse some impairments. So we could do a whole course on looking at individual disabilities and how we would exercise for them. So for us as level 2 fitness instructors, the best thing to do is exercise with care, seek expert advice, although the best person to ask is them, because they'll know what they can and cannot do, but also look to their medical professionals for more information. Work within your knowledge and qualifications. Individuals with hearing or sight impairment can easily be integrated within a regular training environment. So somebody who is hearing impaired, we can simply perform more demonstrations of the exercise that we want them to do. Some of them may lip read as well, so we just need to take that into consideration when we're communicating. And people who are sight impaired will need just more verbal communication, more verbal instruction on the exercise that they are asked to perform. And that completes this section. Any questions on any of that?
Yeah, I've just got one. Sufficiently physically active for disease prevention.
Okay, yeah. So only 7% are actually able to be active enough to prevent diseases from occurring. Does that make sense?
Diseases being.
So it could be coronary heart disease. Thinking about high blood pressure, high cholesterol levels, type 2 diabetes, things like that.
So we're talking about mobility, to be able to
Yeah.
do the exercise, basically.
Yeah.
Okay.
Yeah. So even though we've got 10 million people disabled, only 7% of those have got the capacity to be able
To do, yeah.
to be physically active enough to prevent those diseases. Now,
Yeah. Okay.
this information is quite old, so they may have changed more recently, but this is kind of the curriculum that I've been given from Active IQ for this qualification. So those
Okay.
numbers may have changed in the last few years, but kind of that's just an idea of where it currently is.
Okay.
Okay. Cool. Okay, so that concludes that section. Yes, stop sharing. Stop recording.
Not just a happy one.
Sorry, I don't know what I'm doing.